Hello, my name is Mark Avis, and today I'll be showing what we're witnessing with COVID is the first ever global hysteria. I'll provide evidence from the UK's Office for National Statistics, which show that the UK's mortality rate for 2020 was the same as for 2008. Furthermore, I'll also show that the increase in the mortality rate between 2019 and 2020 was, at the very least, partly the result of government incompetence. As there are lots of conspiracy theories and misinformation surrounding COVID, I'll start by showing the source of the statistics that I'm using, and we'll also show that they are genuine ONS statistics.
Okay, what we can see here is the Office for National Statistics website, and you can see up here ons.gov.uk. Now, this is deaths registered in England and Wales 2020, and this is their final release. Okay, now they make a big deal about the large number of deaths and an increase in deaths in 2020. And if we look at this initial figure, which is figure 1, which is the raw data, and we can see here that yes, there does seem to be a significant increase in deaths. So here we've got males 308,000, females 299,000. And if we move across for comparison, we'll see this is quite high. So, for example, in 1993, males were 279,000, females 299,000. However, if we scroll down a little bit further and we come to the age standardized mortality rates by sex, and this is what they have to say about it. Age standardized mortality rates are a better measure of mortality than the number of deaths, as they account for the population size and age structure. So let's have a look at the figures for that. And what we can see here is, again, let's have a look at it. You can see there is a significant uptick. Okay, and what we find is that for 2020, males were about 1,200, females at about 894. However, if we scroll along, we can find that, for example, in 2008, males were 1,291 and females were 943. So again, we can make the comparison. So at the moment, what we're seeing is the death rate was marginally lower than the death rate in 2008.
Just to be clear, the exact numbers that I just showed are as follows. The 2020 male mortality rate was 1,237, and the male mortality rate for 2008 was 1,292. The 2020 female mortality rate was 894, and the female mortality rate for 2008 was 943. It's very clear that the increase in mortality rates as a result of COVID provides mortality rates that are a little lower than 2008 but also higher than 2019. It's also clear from the statistics that compared with 2019 there was a notable increase in mortality rates, but the mortality rate was not alarming. In particular, nobody was engaged in panic, lockdown, or any other extreme policy in 2008. Instead, the mortality rate in 2008, which is higher than 2020, was considered perfectly normal. However, there's no denying that there is an uptick in mortality between 2019 and 2020. The question is, was it just COVID that caused the uptick, or were there other factors? I'm very sorry to say that, at the very least, some of the increase in mortality was a direct result of government policy. In the next section, I will explain why. The fact that there was an uptick in the mortality rate in the UK is beyond doubt. There is data and policy information which may suggest that, at the very least, some of the increase in the mortality rate was a direct result of government COVID policy. Indeed, we might even consider that the policy was responsible for a large part of the increase, but that would only be informed guesswork. Let's start with the policy itself. As the COVID panic was setting in, and at the start of the UK's response to the pandemic, the government ordered the UK's National Health Service, or NHS, to make room in hospitals by removing anyone from the hospital that could be removed. The policy was called the COVID-19 Hospital Discharge Service Requirements. The subtitle of the report is, "Why Not Home? Why Not Today?" And this captures the spirit of the report. It details the conditions under which patients should be discharged and the roles of the various actors in the policy. The first point of note is that it makes no reference to testing requirements for COVID prior to release. Indeed, in Annex A, they provide the conditions under which patients should not be discharged, and COVID positive is not included in the criteria. Included in the discussions is that care homes should be filled with discharged patients, and there is an expectation that patients would be discharged into care homes. There is absolutely no reference to requirements for COVID testing prior to release into aged care homes. Your mouth may be dropping in shock now. Please download the document yourself if you have any doubts, or have a look at the website version of the article. The links are given below. You can imagine what might happen, for example, if patients were forcibly discharged with flu into aged care homes. Flu deaths would rapidly increase, and COVID is more dangerous to old people than flu. Concerns about the policy were raised in the media on various occasions, but there was no quantification of the degree to which the policy was having a detrimental effect on COVID deaths. The bureaucracy of the NHS, of course, denied that there was much problem. As for the real impact, an article in the prestigious BMJ, British Medical Journal, pointed the way. The author Oliver had this to say in reference to the new patient discharge policy. The report also highlighted concern that some patients were not tested for COVID-19 while in hospital or did not receive their results before discharge. You'll be able to find a link to the report I'm referring to here, and that can be found below. It's a joint report between Healthwatch and the British Red Cross and is titled 590 People's Stories of Leaving Hospital During COVID-19. As the title suggests, they followed up the experience of 590 patients discharged under the new COVID policy with surveys and interviews. It turns out that many people were discharged from hospital without any COVID test. As can be seen from the figures from the report, the vast majority of patients in March were being discharged with no test. The situation improved up until June, only to see an alarming and rather shocking decline thereafter. This is truly shocking data. However, it's worse than it initially appears. Even for those who were tested, many were not getting their test results before being discharged. Again, alarmingly, after an initial improvement in the numbers, they get worse over time. The report then details that carers would meet resistance from hospitals if they asked for the COVID status of the discharged patients. This sometimes resulted in care homes refusing to accept admissions of patients without tests or without results being shared. These refusals were often met with challenges from the hospitals. Of course, many hospital staff regretted the lack of testing when patients were being placed into care homes. What is very clear from the NHS directive and the report on what happened with the discharged patients was that large numbers of patients were being discharged from hospitals with no tests for COVID or no test results. Many of the discharged patients were being sent into aged care facilities. Bearing in mind many of the patients would have been in wards in the hospital, there was a higher than normal chance of them being infected. Hospital wards, I think I'm safe to say, would be an ideal location for transmission of the virus. The policy was changed in mid-April with a requirement for testing before discharge. However, from the report it was apparent that the new system of discharge was chaotic. Thus, even after the new directive, many patients were being discharged with nobody knowing their COVID status. The change in policy in mid-April was, of course, too late to stop the spread of infection into aged care homes, where the most vulnerable lived, and they lived together in close proximity. I have no idea how many of the deaths in the UK are the result of the jaw-dropping, foolish policy that was enacted. Similar policy was followed elsewhere, such as New York, and New York was notable for having one of the highest death rates in the United States. With this debacle in mind, we can return to the UK death rate for 2020. How much of the increase was simply due to the policy of discharging patients without COVID testing? Again, think what would happen if it was just flu-infected patients. In addition, the chaotic policy of emptying out hospitals, as detailed in the Healthwatch and Red Cross report, saw vulnerable people being thrown out of the hospital, and often with little care or support. How many deaths from that? And then there were the people not going into the hospitals, the halting of testing, and all of the other knock-on policies, from emptying the hospitals of any but the most critical patients plus COVID cases. To these potential increases in death rates, we might also wonder about the potential deaths from lockdowns, such as increases in suicides. At the moment, we can only speculate about these questions. Remembering that the UK was considered hard hit by COVID, we're left with some uncomfortable thoughts. Indeed, I was aware that there was something very wrong with what was taking place when, in my home country of New Zealand, we first went into lockdown. Around about week 2 or 3, March-April time of the lockdown, I was starting to see statistics that were raising serious doubts about the dangers of COVID. However, there was nothing so substantive that I could call it smoking gun evidence. As time continued though, evidence continued to mount that what we were seeing was a hysteria. The implications of what I was seeing were convincing me that what we were seeing was madness. Eventually, because I found the implications so disturbing, I stopped even looking at statistics to do with COVID. I actually deliberately buried my head in the sand. How could so many institutions engage in this madness? This was the question I did not want to confront. It was only when New Zealand went into a new lockdown that I finally returned to looking at the statistics and saw the ONS statistics. I believe that the statistics from the ONS represent quite how mad the response to COVID has been, and do so conclusively. As much as the ONS tries to direct our attention away from the age-adjusted mortality rate in the report, it's still there. I suspect that someone brave in the ONS wanted us to see those statistics. These are people who love numbers, and they could see from their own statistics the madness that was taking place. I don't have any data, or similar data for any other country, but we should remember that for OECD countries, the UK was considered hard hit. I've no reason to believe any other OECD country will be significantly different. As such, the only conclusion we might come to is that the world is now going through the first ever global hysteria. And the most worrying part is that across different countries and a multitude of institutions, they've all gone along with the hysteria. This is the implication that led me to metaphorically bury my head in the sand. This leaves open the question of why this has happened. I've spent an uncomfortable amount of time trying to work this out, and I'm still unsure. However, that's a video for another time. In the meantime, you might look at your own government and your own institutions and ask yourself the same question. Why?